trauma bay held its breath. Nurses paused mid-stride, a tech froze with a chart in hand. Monitors kept their thin, indifferent beeps. Only the woman in navy scrubs kept moving. Rowan Keene tucked stray hair under a cap and walked straight through the hush into the prep room. The fluorescent light stung. The stainless steel sink threw back her reflection in a warped band. She turned on the water, too hot. Steam climbed the mirror in a white veil. She scrubbed to the elbows, palms, wrists, every digit, her rhythm steady, the kind you could set a metronome to. A cheap plastic watch ticked at her pulse. A thin white scar crossed the inside of her wrist like chalk. Behind her, the door opened. Leather soles, a paper mask around a neck that belonged on a portrait. Dr. Harlan Pierce did not look up from his phone until her second rinse. He slid the device into his pocket, eyes gray and cool. "You are the new second year." Rowan kept scrubbing. "Yes, sir. Keene." "County General," he said. Not a question. A diagnosis. She held her hands up and let the water run. The faucet hissed. Soap smell sharp and clean mingled with iodophore. She watched the suds cloud and streak, then thin. Pink swirled from her forearm, hardly anything, just a memory lifted from a dried scratch. The current caught it and dragged it to the drain. Clear again. He took her in for the first time from stance to shoulders to the set of her jaw. "You will take the appendectomy in OR2. Straightforward. Do not be creative." Rowan nodded. Her chest rose once. "Copy." In the corridor outside, two interns leaned into each other. "County kid." Barely past one breathed eyes on her shoes. The other chuckled under his breath. "She looks tired already." Rowan keyed the OR list as she walked, reading the grid the way some people read faces. Appy in 2, Lap Chola in 4, motorcycle on I-5 incoming, ETA 12 minutes. She pushed into the scrub room, met the circulating nurse with a glance, caught the weight of a scalpel in memory before it touched her hand. The patient in OR and OR2 had a black toss of hair and faint freckles across his shoulder. 28, no allergies, vitals clean. The monitors wrapped the room in green and white. The anesthesiologist murmured numbers. Rowan looked at the abdomen, at the shallow rise and fall, at the color along the drape edge. She did not touch yet. She watched. "Scalpel," she said. The blade opened skin with a sound like tearing paper. Subcutaneous fat eased apart. Fascia gave. She lifted the muscle with 2 fingers and felt it slide obediently. The peritoneum sighed as she nicked it. The smell came up and found her. Not clean, not neutral, sour dark old. "Suction," she said. The field cleared. The appendix did not look recent. It looked betrayed. The perforation had a rim, not a tear. Purulent fluid hung in sheets. There was contamination that had made a home. "This is not acute appendicitis," she said, voice even. "This is perforation with established peritonitis. He is septic." No one answered. The beep went steady, then quickened by a notch. She did not look up. "White count on admission?" she asked. 18, the anesthesiologist said. Temperature was 101.4. "He has been symptomatic for days. We are converting to exploratory laparotomy. I will need large Richardson's, extra suction, additional sponges. Page Dr. Pierce." The scrub nurse hesitated. "Pierce is in 4. "Page him," Rowan said. "This patient will not wait." She extended the incision. The room shifted around her, instruments changed hands, trays rattled. Her movements looked unhurried, but the field changed under them. She broke an abscess pocket in 90 seconds, cultured it, moved to another quadrant. The suction hissed and pulled and cleared again. The door bumped. Pierce stood in gown on mask, loose at his throat. "What is this?" "You paged to Stat Surgical for an appy." She did not stop. "Perforation peritonitis, multiple abscesses. Source control is in progress." "You converted without attending approval." "There was not time," Rowan said. "His blood pressure is softening. You should have closed and consulted." "If I had closed, he would be in arrest now." Silence like a hand. Then the suction. Then the beep. Pierce stepped forward. His gaze dropped into the open belly. He really looked, his jaw set. "Those sutures," he said slowly, "that is not standard." "It is effective," Rowan said. Her needle bit and tied, an interrupted pattern that let fluid escape and edges meet without strangling them. He watched for another minute, then 2. The scrub nurse glanced at him, then at Rowan. The anesthesiologist adjusted a drip with a small click. The room ran on. The contamination reduced. The field turned cleaner than it had any right to be. When Rowan began the closure, her hands did not change tempo. In the scrub room afterward, the water ran hot, almost too hot. The pink lifted quick from her knuckles and spiraled lighter and lighter, then clear. She stood with elbows dipped and let the heat bite. The mirror fogged. Her face blurred until it was just a shape. A tablet appeared in the glass. The reflection belonged to a woman in a surgical cap with dark eyes that saw details like threads. Mia Sato. She did not come all the way in. How did you know, Mia asked, in there, that it was not simple? Rowan dried each finger, the smell, and the story did not match the scan. Classic on paper tends to be messy in life. Your closure, Mia said softly. I have seen that pattern in a paper. Austere settings. It vents. Rowan folded the towel. I read. Mia smiled small and sideways. You read a lot. She tapped the tablet against her hip. Good work. Rowan opened her locker. Inside folded neatly a gray sweater, a protein bar she would not eat. A little metal coin in the corner with an eagle rubbed thin. She pushed the coin deeper under the sweater and closed the door. In the residence lounge, the coffee had already burned past redemption. 3 first-years sprawled over 2 chairs and a couch. They stopped talking when she stepped in, one of them badge reading. Chen lifted his chin as if a comment had hung between his teeth. Heard you went from appy to open, he said. Pierce looked pissed. Patient needed it, Rowan said. She poured the coffee and felt it in her hand like a small furnace. You do not make that call, Chen said. You ask. Sometimes you do not have time to ask. Rodriguez, the woman on the couch, leaned forward. Where did you train Keen? Before county. Different places. That is vague. It is accurate. Your technique is not textbook, Chen said, half accusing, half curious. My technique keeps people alive, Rowan said. She took a sip, grimaced, kept the cup anyway. Protocol would have sent him back to recovery. He would have coded by midnight. She set the cup down. She walked out. The hallway was glass and light and the smell of sanitizer. Monitors beeped in rooms she passed, each with its own little rhythm, a chorus of machines counting. She logged her case at a terminal and stared at the sterile blue text until it stopped blurring. Her shoulders sat high near her ears. She let them drop. Her pager chirped. ER trauma consult. She pivoted and cut through 2 corridors and a stairwell that always smelled faintly wet. Harper Light Medical Center opened like a map from the landing bays on one side, curtains on runners' bright squares where portable x-rays lived. The charge nurse, a woman with gray hair, pulled into a no-nonsense bun, lifted a hand. Motorcycle wreck. Jace Rivera, 23, laid it down on I-5. Left arm is road rash. He is awake. Vitals borderline. Rowan took the curtain in her fingers and drew it aside. Jace tried to grin and failed. His mouth twitched and faltered. His skin had gone a shade too pale to belong to the living without help. I am fine, Doc, he said. It looks worse than it is. Rowan placed her hand on his abdomen, quadrant by quadrant, gentle pressure methodical. He flinched over the left upper side. She listened to his chest. Breath was thinner on the left, like a wind that could not get through a screen door. She glanced at his neck. The veins said something his mouth did not. Portable chest x-ray, she said. The machine arrived like a boxy animal and did its work. Dr. Ethan Cole fit himself into the space at her shoulder and eyed the plate as it popped up. Vitals are acceptable, Cole said. We can observe. It will not resolve, Rowan said. He is building pressure. His rate is climbing. We do not do invasive procedures based on theoretical progression. Rowan looked at Jace. Blue crept at the edge of his lips. His nostrils flared with each breath. The tendons at his neck were cords. Chest tube tray, she told the nurse, left side. Cole drew a breath, keen. Give the correct order, she said, or I will. Silence for a beat. Then Cole lifted his chin at the nurse. Set it up. Rowan numbed the skin. The blade met rib, found space slid in. The sound of escaping air was a clean, wet sigh. Jace inhaled as if he had been underwater and had just broken surface. Color chased itself back into his face. Oh, he said, better. Rowan taped the tube. She wrote orders on the board with a blunt marker that left bold strokes. She cleaned her hands at the sink. The water ran hot again, harsher now on skin already scrubbed too many times. The pink swirled and disappeared, clear. When she looked up, she found Mia in the doorway, that same half smile, that same careful gaze. You keep doing that, Mia said, turning what looks simple into what is true. Rowan tossed the towel. I listen. The overhead speaker cracked. A siren voice cut through every other sound. Motorcycle MVC ETA 4 minutes. Rowan did not finish her coffee. She was already moving shoulders squared, steps quickening to the tempo of the beeps that were about to change. The new motorcycle rolled in with a grind of stretcher wheels and the sharp stink of hot rubber. The rider was alert, left shoulder scraped, raw chest, clear abdomen soft under Rowan's hand. She listened, counted, pressed. Breath equal, pupils brisk. She nodded once at Dr. Ethan Cole. Fluids, tetanus, pain control, she said. Watch for a slow bleed. Page me if his belly hardens. Cole gave a curt yes. The charge nurse lifted 2 fingers from across the bay, a small salute that meant we saw you. Rowan peeled off her gloves, tossed them, and climbed the stairs to the OR level. Her pager buzzed, or 4 ready. Patricia Ellison was already under 60, skin the color of tea, with milk, a small bruise near the navel from trocar placement. The laparoscopic tower glowed blue. The room settled into its hum. Dr. Harlan Pierce stood at the back with arms crossed, eyes on the monitor, not on her hands. Ports in, she said. Camera. The screen filled with a slick landscape pearly liver on the right, a pale gallbladder cupped underneath the triangle of calotte, faint as a sketched idea. She took the hook cautery and traced light along the peritoneal sheen. Steam rose like ghost breath. The monitor's beep kept a soft rhythm behind anesthesia's whispered numbers. Dissection, she said. The scrub nurse passed a Maryland dissector with a snap of metal into metal. Rowan lifted the gallbladder, neck teased down the peritoneum, cleared fat, opened a window, then another. The cystic duct revealed itself in a vessel above it that should have been a line. It was not. It ran posterior, tucked behind scar. She paused and held the instrument very still. Problem, Pierce asked. Not quite boredom now. Anatomical variation, Rowan said. The cystic artery has a branch that is not where the book puts it. She adjusted the camera angle by 2 degrees. The world shifted subtle yet clean. The vessel's course came into view. Thickened walls, little collar of fibrosis. Clip there, and the right hepatic could suffer. She felt the presence behind her, Pierce, taking a step closer to the field of light. Most residents miss it until they cause it to bleed, Pierce said. His voice had no edge, only observation. Rowan did not answer. She worked. She stripped more tissue back, exposed the fork and the posterior curve. 17 minutes bled into the case like ink. Anesthesia called out stable, stable, still stable. She measured the distance with her eyes, counted the pulse in the vessel through the tip of her instrument as if the steel had fingers. Clip, she said. The first clip kissed the cystic duct. The second took the errant branch clean with space on either side. She checked for oozing. The field held. No flash of red, no swell. Another clip, then divide. The gallbladder eased off its bed. She put it in the bag and drew it out through the umbilical port. The monitor smoothed out to a quiet blue plane of liver. Pierce stood near enough now that she could hear the cotton scrape of his sleeve when he folded his arms again. How did you catch it? He asked. The angle. Tissue planes, Rowan said. They were wrong for the usual map. He made a sound in his throat that could have been acknowledgement. Or something else. She irrigated, checked for bile, dried, then closed. Port sites, subcuticular, neat and small. No flourish, no waste. The scrub sink bit hot into her hands. The water carried warmth and a thin dusting of pink from a nick near her thumb. It whirled and lightened and ran clear. She watched the swirl for half a breath longer than necessary. When she lifted her head, Mia Sato was in the doorway with a tablet under her arm and that slight mischievous tilt of a smile. She did not waste time. I pulled a paper, Mia said. Damage Control Surgery in Austere Environments. Journal of Trauma 2020. Author initial C.R. Keene. Rowan reached for the towel and took her time with each finger. The paper describes interrupted patterns for contaminated fields, Mia said, almost conversationally. The photos look like your closures from earlier vented tension-managed drainage accounted for. I read the literature, Rowan said. You also write it, Mia said. Her tone was gentle, not a challenge. A thread pulled, not a stitch torn. Rowan dropped the towel in the bin. Her locker door opened and the little coin sat in the corner, worn smooth on one face, an eagle faded to a smudge of light. She pushed it beneath the gray sweater and shut the metal with a calm hand. In the corridor, an elevator poured out white coats. 2 interns drifted near like gulls watching a trawler. Chen lifted his chin at her, again curious bright to cover something like awe. That coal took long, he said. Heard you were fishing. She stopped. I was looking. There was a variant. If I had clipped blind, the liver would have paid. He thought about that and nodded once. Rodriguez leaned on the wall with arms folded. You talk like the scan is a rumor and the body is the truth, she said. Rowan started walking. You can hold both if you pay attention. She did not wait for a response. The residence lounge stank of burnt coffee and microwave pasta. She poured fresh water from the cooler into a paper cup and let it sit on her tongue room temperature and metallic. Her shoulders throbbed. The edges of her awareness held static. She breathed it out and let the hospital's pulse replace it. The charge board had a febrile toddler, a laceration from a kitchen knife, an elderly woman with chest pressure and normal EKG, a man who had swallowed a coin on a dare. The routine churned, and in it her pager showed a new line. Post-op orders for Patricia signed recovery stable. Good. Dr. Pierce crossed her path without speaking. He slowed half a step when he was level with her. The lines around his eyes had shifted. Not softer, more focused. Most would have stayed with the standard approach he said. Rowan held his gaze. The screen only helps if you are actually seeing. He grunted. It might have been praise, or only the sound a man makes when a piece on his mental board moves by itself. Mia met her at the corner of the stairwell. There is something else Mia said. The ER attending Cole is telling people you are reckless. Rowan took that in without flinch. He is careful. That has value. It does, Mia said, until it does not. Before Rowan could answer, the overhead speaker cut into the hallway with a voice that always pulled people to their feet. The charge nurse's tone had no wobble. Attention all clinical staff. Mass casualty incoming. Crane collapse at Elliott Bay shipyards. Multiple critical. First ambulance 2 minutes. The hospital turned. Carts that lived in niches rolled out. Orange trauma packs cracked open and sprouted tubing. Nurses passed each other side by side with a precision that looked choreographed. The air began to vibrate with the first hint of siren. Somewhere below, a door thunked as the ambulance bay engaged its hydraulic tracks. Rowan moved with the current. Down the stairs past the vending machine that always hummed too loud into the ER, where curtains were pulled full open and stretchers stood waiting. She found the charge nurse, the gray bun, the steady mouth. How many bays? Rowan asked. 5, Prep, the nurse said. Reports are crush and penetrating, steel and concrete. 1 probable chest, 2 abdomens, 1 head, 1 orthopedic mess. Rowan nodded. She felt the coin in her pocket that was not there. Ghost habit. Her hands flexed. The gloves snapped when she pulled them on. The monitor in Bay 1 was already awake, a green line flat, waiting for a body to give it a reason to move. Outside, the first siren rose through the throat of the city and slid across the water. The sound pressed against the glass like weather. Rowan found her place at the foot of Bay 2 and set her feet where she could move and not stumble. The beeps around her found a tempo. Her breath matched it without her asking it to. She watched the doors. The red lights painted a thin ribbon on the floor. The ambulance backed in. The world leaned forward. The bay doors opened and the siren poured inside. Paramedics pushed a stretcher that rattled like loose metal. The first patient wore gray dust like flour, a hard hat still strapped, eyes glassy and unfixed. James Calder, 41, the medic called. Crane collapsed chest and abdomen crush, hypotensive tachycardic. Bay 2, Rowan said. 2 large-bore IVs, type and cross 6 units. Fast now. Gel hit skin. The ultrasound bled black pools into a field of gray. Free fluid shimmered in Morrison's pouch and along the splenic edge. Breath sounds were quieter on the right. He winced when Rowan pressed left upper quadrant. He is bleeding in the belly and possibly the chest, Rowan said. Prep for chest tube on the right. Call the OR and tell them we are coming up emergent. She leaned in. James, stay with me. Stare at a point on the ceiling and do not blink until I tell you. He squinted, then peered past her, past the lights, one hand grabbing at air. His focus landed on her face. Recognition found purchase. Doc Keene, he whispered. His voice held sand. Kandahar. The convoy on Highway 1. You fixed Torres in the back of a Humvee. Rowan felt movement stop around them. It was not loud. It was the sound of no one breathing. Hold still, she said. You are hurt. We will take care of you. He smiled through a grimace. Yes, ma'am. She looked up. The room had eyes on her now, not on the monitors. Mia stood near Bay 3 with a hand still on a patient's shoulder, head tilted, calculating. Dr. Ethan Cole hovered at the edge like a cliff face. The charge nurse adjusted the infusion rate with precise fingers that did not tremble. Chest tube now, Rowan said. The catheter slid, the pleura gave, and blood spilled into the collection chamber a steady red. Breath sounds improved. The monitor registered a small rise in oxygen saturation. Rowan kept a hand on the belly. It was firmer than 10 minutes ago and getting firmer. The skin started to gloss. "We go upstairs," she said. Dr. Pierce stepped into her line of sight. "I will take Bay 1. Head injury. You have this abdomen." "Understood." They moved a practiced migration. The elevator doors closed on the echo of another siren. In the mirrored steel, Rowan saw 3 faces, her own tight and steady, the circulator pale, the anesthesiologist's jaw working like he chewed an old thought, or lights erased everything that was not the field. They flooded the room with clean white and took the rest away. James disappeared beneath drapes except for the square of his belly. Vitals hung in the air like numbers on a chalkboard. Not good. Not disastrous yet. "We start midline," Rowan said. "Suction ready. Pack available. Warm blood on hand." The scalpel bit. The fascia opened under 2 strokes. She entered a dark lake. Blood welled, then surged. It smelled of iron and old pennies. The suction talked back a low hiss as it drank. She packed 4 quadrants with sponges, felt for a splenic mass that was not a mass-only tissue torn beyond use. The hilum whistled under pressure. Grade 4, at least, she said. "Hilar involvement. We will not save the spleen." She traced the splenic artery with the back of her finger, found it near the superior border of the pancreas clamped proximally. The field calmed a fraction. The bleeding became a mutter, not a shout. She placed a second clamp closer to the hilum. Clamp tie. Clamp tie. The rhythm steadied her breath. She felt the vein as a soft tube that wanted to collapse. She swaddled it with silk and persuaded it closed. The liver bled from a mouth along segment 6. Not a torrent, enough to matter. She packed it with lap pads pressed weighted for the oozing to darken and give up. There was no bile. Good. Across the table, Dr. Pierce watched without commentary. Not frozen, not interfering. Present. His hands did not fidget. His eyes moved with her sutures and her clamps and the small shifts that a surgeon makes when their hands know more than the plan. "You have done this before," he said in a voice meant for her and no one else. Rowan did not look up. "Identify control repair," she said, as if naming steps gave them weight. The spleen came free with a wet sigh into a bowl that waited like a mouth. The scrub tech whisked it away. The field looked less like a battlefield now. The red was darker, the edges of things had reappeared. Anesthesia called out blood pressure numbers that lifted by 5 points, then 10. Heart rate eased from 150 to 130. Rowan checked again for bleeding in the 4 corners. Nothing active. The pancreas looked clean. The left diaphragm looked intact. "We irrigate," she said, "then close. He is not out of danger, but the hole in the boat is smaller." The suction slurped and the warm saline flowed clear. She placed sutures that were interrupted and forgiving the pattern that let wounds drain and still meet. The scrub nurse watched her hands the way someone watches handwriting, trying to guess the person in the script. They rolled to recovery. The OR doors swung behind them, and the hallway air hit cold on the skin near Rowan's wrists. She peeled off gloves. The wash bit hot, and the pink spiraled out of view. Clear. The sink hissed. Her reflection fogged and then did not matter because the trauma line rang again, and the charge nurse's voice cut the floor clean. Gunshot wound to the chest. ETA 3 minutes CPR in progress unresponsive. Rowan exhaled once. Mia appeared at her side as if pulled by a string. "That is a field call for time of death," Mia said under her breath. "Not here," Rowan said. She reached the ER in 7 long strides. The trauma bay was a stage set before anyone arrived. Thoracotomy tray already open, rib spreaders catching light, suture cut to length. A nurse stood with a chest tube in her palms like an offering. Ethan Cole faced her with his arms folded high. 15 minutes down, he said. Fixed pupils in the field, no pulse. "We will be declaring." Rowan looked at the tray, then at him. "No, you cannot be serious." "He is 19 if we are lucky," she said. "He has a single wound to the left chest. If it is a ventricular injury near the apex, and there is a chance. We open here. We do not have bypass. We are not set up for that. I will work without it. Cole's mouth went flat. The charge nurse watched them both with a neutrality built over decades of disasters. She lifted a gloved hand. Orders, doctor. Bay 1. Resuscitative thoracotomy kit. Direct cardiac massage if indicated. Epi ready. 2 units uncrossed to bedside. Prepare for transport if we achieve rhythm. Bleeding without circulation is not bleeding, Cole said, which was not untrue. He is not dead until I say he is, Rowan said. Her voice did not rise. She set the rules with tone. The ambulance siren cut off outside like a song strangled. The paramedics burst through with the gurney rolling hard, one on the chest, counting compressions, one bagging. The patient was a boy with a sparse chin beard and a bullet hole in a t-shirt that said Mariners. Blood soaked the cotton to black. His lips were the color of tidewater. Marcus Lee. 19. The medic panted. Single GSW left chest. Down at least 15 before we arrived. No pulse in the field. CPR ongoing 12 minutes. Pupils fixed 3 millimeters non-reactive. Transfer, Rowan said. Compressions paused as they lifted. The patient hit the trauma bed. She cut the shirt in one long swipe. No exit wound in the back. Breath sounds silent on the left. Heart sounds absent. She checked a carotid. Nothing. Resume compression, she said. Then to the room. Clear if you are not essential. Cole did not move. He stood at the edge, hands on hips, eyes hard. Pierce came in and took a place without a word, not in command, not in conflict, only there. Scalpel, Rowan said. The knife slid at the 5th interspace. The thoracotomy opened like a mouth that did not want to. Rib spreaders went in, and the click as they widened seemed too loud in a room full of alarms. The heart sat still in the chest like a clenched fist that had forgotten how to open. A neat hole in the left ventricle oozed a thread of dark. Stop compressions, Rowan said. She took a needle with 4-0-proline and put the first stitch through living muscle. It felt like sewing wet leather. The edges met. She tied with 3 throws, then another stitch, then another. The hole closed. She placed her hand around the heart, felt the cool weight, and began to squeeze. Release, squeeze, release. Her palm learned a new rhythm and taught it back. Come on, she said, quiet as if coaxing a child out from under a table. Epinephrine, Pierce said. 1 milligram direct. Rowan injected into the muscle. She resumed massage. The monitor caught a flicker. It hiccuped. A QRS complex climbed out of the flat line like a swimmer finding the surface. Another. Then a staggered pattern that made almost a pulse. I have something, the nurse said. Low, but there. Rowan kept her hand until the heart tried to beat against it. She let it. She guided without forcing. The rate crawled up from 40 to 50, then 60. The skin along Marcus's neck twitched with each weak beat. Secure the tube, Rowan said. Prep to move. We will finish repairs upstairs. They pushed. The wheels squealed. The doors opened like they were lighter than air. In the hallway, Rowan felt sweat under her cap, and her hands shook and she told them to stop. She looked at her palms. They were steady. The shake was somewhere else. Or, 5 Mia said already on the phone as she jogged beside the bed. Cardiac and thoracic on alert. Rowan glanced through the window of a passing bay. The man inside had a leg that was no longer a leg but a puzzle. A nurse held pressure with both hands. Another intern tied a tourniquet with her teeth. Rowan cataloged the image and let it go. The elevator lurched, then smoothed. Marcus's heart kept time like a beginner learning a song. It faltered, then found it again. The monitor tone tried for confidence and almost got there. They spilled into the operating room and the lights took the color out of everything. The anesthesiologist called out numbers in a cadence that matched Rowan's breathing. The chest retractor held the left side open in a red crescent. The hole in the heart stayed closed. The left lung had a wound in the upper lobe and a slit in the posterior surface that hissed when the ventilator cycled. We repair the lung, Rowan said, then check for vascular leaks. She sewed the entry and exit with a precision that did not waste thread. A small bleeder near the left pulmonary artery flashed, then subsided under a well-placed suture. The field cleared. The suction fell quiet. The heartbeat without her hand. Close, she said. The rib spreaders came out. She approximated ribs, muscles, subcutaneous tissue. Skin last with the same interrupted pattern that had marked her in the earlier room, a signature without a name. The drapes came down. The ventilator breathed for Marcus with calm, even strokes. They rolled for ICU. Rowan stripped her gloves. The sink offered heat, and she took it. The water showed a swirl of pink that faded to clear. She stood with her hands in the stream until the burn of the day pulled back from her skin. Behind her, through the glass, nurses set lines and hung drips, and a young man lived who had not lived when he entered. A voice on the overhead speaker found them even there. All available surgical staff to the ER. Additional casualties incoming from Elliott Bay. Rowan turned the water off with a clean push. The beeps in the hall aligned. The elevator doors opened on a brass mirror. The woman in it was the same and not the same. She did not pause to study her. She headed for the stairs. The ER had changed shape. Curtains were tied back. Bays overflowed onto hall space. The air smelled like concrete dust and iron. Sirens layered, then peeled away as each rig docked. Rowan took Bay 4 with the nurse who wore a silver ring on a chain. The patient was mid-30s with a split scalp and pupils that did not match. Left big, right tight. She lifted the head of the bed, angled oxygen called for mannitol. The monitor beat slow and stubborn. She touched the man's shoulder and the bone beneath felt wrong, a shelf with a crack. Over Mia called from Bay 3, femur through skin. I have distal pulses. Keep them, Rowan said. Shoot films. Antibiotics now. Dr. Ethan Cole stood at a workstation with a chart he was not reading. Someone yelled for more suction in Bay 1. Another voice asked for the ultrasound. The machine clicked on and the room across the way filled with a wet black on the screen. Free fluid again. The charge nurse called it to the room at large in a voice that did not shake. Rowan crossed to Bay 7 at Pierce's gesture. A man lay with a belt of small punctures across the lower abdomen, where rebar had kissed him through falling metal. He guarded against her hand. His belly rounded and firm. Sweat filmed his lip. Vital signs tried to hold a line and did not like it. Peritoneal signs, Rowan said. Penetrating. He goes upstairs now. Cole hovered at the foot of the bed. He is stable. Observation could. No, Rowan said. He is compensating. He will buy you time until he does not. Pierce watched her, then the man, then her again. How many of these have you seen, Dr. Keene? Enough to know that waiting is a decision, she said. He nodded once, then his focus flipped outward. Move. They wheeled the man toward the elevator. Rowan let Pierce take him and turned back to the bays, where a young woman with a crushed hand sobbed in hiccups, and a boy not unlike Marcus stared at nothing with dried blood on his neck. She triaged with her hands and with her eyes, not the clipboard. Airway, breathing, circulation. Who was loud, who was quiet in a dangerous way. The nurses moved like music she already knew by heart. In Bay 3, a resident froze with a chest tube in his hand and the patient's oxygen dipped. Rowan stepped in close enough for the resident to feel her presence and not feel pushed. Feel for the rib, she said. Walk off the top, count the spaces. Now advance. You have it. Keep going. Stop. Turn. Good. The hiss came. The numbers rose. The resident breathed out like someone surfacing. He kept his hand steady as he secured the tube and tied. Rowan squeezed his shoulder once, then was gone. Another patient barked in agony when someone moved a pelvis that did not want moving. Rowan held her hands up so everyone could see them. Do not turn him, she said. Sheet wrap, binder, straight to imaging. 2 hours ate themselves. 5 critical patients became 5 breathing, watching still and quiet, medicated, and monitored, each with a plan and a path. The ER softened back from red to yellow. The noise shifted from ceiling-high panic to thigh-level fatigue. Rowan stood at the sink and let the hot water teach her hands where they ended again. Pink fled the knuckles and the creases, and the whirlpool went pale and clean. The skin burned and then settled. Her shoulders ached with a steady low note. She watched the faint steam on the mirror until it blurred the fine lines under her eyes. Pierce found her there. He leaned on the far end of the counter and studied the tile instead of her. Then he raised his head. How many can you carry at once, he asked. As many as arrive, she said. He let that sit. Then he said, there is a board meeting tonight. They will ask about what happened in the ER. Tell them the staff did their jobs, she said. He did not answer that. He pushed off the counter. Come with me. His office was small. Diplomas ran the wall. The blinds cut the late light into soft bars. He closed the door with a careful hand. He opened a drawer and took out a hard folder, not the slim electronic kind that lived behind glass. Paper. He set it on the desk and opened to a page already flagged. Your file notes military service, he said. It does not note detail. It notes what matters, she said, for credentialing. He slid a paper across the desk. It had a letterhead she knew too well. Her name in block at the top, rows of black type. Parts were redacted into a sudden night. Pierce put a finger under a paragraph and pushed. Is this accurate? He asked. The words named a day and a place and bodies and a series of actions that went on for 19 hours, while rockets fell like rain that did not refresh. It named a commendation she did not display and did not discuss. Yes, she said. Pierce sat back. He looked at her the way surgeons look at CT scans, when they are not sure if they are missing something. Why not say he asked? Why keep that history at the edge of the page? She picked at nothing on her scrub pants, the kind of small motion that keeps a hand from making a fist. Because it is not relevant to a gallbladder, she said. It does not repair a liver, it does not change a knot. He opened another section. It was shorter. It used a word that lived on brass and hung at ceremonies. His eyes moved past it and stopped and stayed. Medal of Honor, he said, whisper quiet. Rowan felt the weight of the little coin in her locker, a substitute for a ribbon that sat in a box at the back of a closet. She did not reach for it. It is a piece of metal, she said. It reminds me as much of who I did not save as who I did. Pierce watched her longer. She could not tell what changed in him as he did. Something tipped. The chief of medicine would like a word, he said. Now. Lillian Ward's office smelled like paper and lemon cleaner. The blinds were up. The city looked back in squares of glass and water. Ward wore her gray hair short and her jaw set, and there was something in her eyes that knew ship quarters and bad weather. I pulled your complete record, Ward said. The confidential one. Dr. Pierce briefed me on what you did today and what you did before today. Rowan stood because Ward did not offer a chair and because sitting would suggest she wanted comfort. Her hands loosened at her sides, by choice. You are not a typical second-year resident, Ward said. Your case numbers surpass those of most attendings. Your outcomes under constraint are exceptional. You handled a mass casualty incident as if you had rehearsed it. You performed a resuscitative thoracotomy in the ER and brought a 19-year-old back from flatline. Then you finished the work upstairs. Rowan inhaled. The air felt cool because the lemon-masked hospital, and somehow that surprised her. We have tried to build a trauma program for 3 years, Ward went on. Facilities are in place. Equipment is funded. What we lacked was a hand that had seen the chaos and would still write a clean line. We have that hand, if you want it. Rowan's throat found a swallow. She did not rush it. What do you mean, she said. A formal attending post, Ward said. Director of Trauma, full privileges, autonomy, authority to train and to set protocols informed by what you have actually done when the algorithm fails. You will answer to me. I will not interfere with medical judgment. Pierce stood near the window, hands in pockets, face unguarded for once. He met Rowan's eyes and did not look away. Rowan's body remembered the tent. She did not invite it. It came anyway. The generator coughed. The light went out for 7 seconds mid-suture and came back with a stutter. The sand got into everything. Hands slipped. Laughter was sometimes too loud because the choices were laugh or break. Why me, she said, a useless question. She knew why. She needed a second to file it. Because you are already doing the job, Ward said. We are only naming it and giving you the tools for it. Rowan kept her voice level. I will not be introduced with a medal, she said. I will not have my past turned into a headline. I will not have a camera crew set up in a hallway while a nurse is trying to start a line. Agreed, Ward said. Your service will be acknowledged precisely to the extent that it explains your competence. We will not turn it into a banner. I choose my team, Rowan said. Mia Sato is my first pick. Ward nodded. I want honest morbidity and mortality, Rowan said. Failures on the table, lessons plain, no blame without action, no praise without numbers. Pierce made that small sound again that might have been approval. Ward's mouth tucked and then straightened. Also done, she said. Rowan stood in the center of the quiet. A change of this kind does not announce itself inside the body with trumpets. It is a coin rolling in a pocket and the small shift of weight when you turn. There is another piece, Ward said. We have veterans who enter civilian medicine with skills the system does not know how to weigh. Build a bridge, a training pipeline for military clinicians. Bring them through. Translate their work. Do not let what they know die because a form has the wrong box. Rowan let that land. She thought of a medic named Rojas who could intubate in a truck by feel while the wheels bounced off ruts, and who froze during his first quiet elective case because silence scared him more than rockets. She thought of a nurse who could triage 30 in 10 minutes and who hated EHR tabs because they did not change color like the triage tags did. She said, "I will give you an answer tomorrow." Ward accepted it with a nod. Her hand when she offered it was strong and dry. Pierce did not try words as they left. He walked her to the door and held it, and that said enough. The hallway had the dim lull of late afternoon when alarms ease for a moment and people take longer breaths because they can. Rowan went back to the sink because water gave the hands something to do when the head ran hot. The heat bit. She watched the pink, then the clear. The glass beside the sink held her reflection and Mia's when Mia stepped in behind her. The door swung shut on a whisper. "Are you all right?" Mia asked. Rowan kept her eyes on the mirror. "I am not broken," she said. Mia tilted her head. "Good, because they are going to give you keys." Rowan half laughed. It sounded like a cough that forgot to be one. "I do not want a spotlight," she said. "Then do not stand in it," Mia said. "Stand where the work is." They let silence be the kind that is not empty, the kind that means we made it through the last hour and the next hour is somewhere else waiting its turn. A stretcher rolled past the open door. The wheels squeaked. A tech cursed under his breath and then apologized to no one. The ER breathed. The hospital ticked. Pierce's voice found her from the hall. "Keen." His tone held no rank, only request. "The board wants numbers." "Give them numbers," she said without turning. "They will also want a face," he said. "They can have yours," she said. She dried her hands. The towel left no lint. She placed it in the bin like a ritual. Her pager buzzed against her hip. The display lit a simple 4 letters that made the breath in her chest change course. ICU. ICU glass held the reflection of her face and the slow green slope of a heart that had decided to keep going. Marcus Lee lay quiet with a tube at his mouth and tape across his cheek. The monitor clicked at 80. Blood pressure had climbed into a range that did not frighten anyone. Marcus Rowan said, "Can you hear me?" His lashes flickered. His eyes opened and found her. Slow at first, then steady. "Do not try to talk. Blink twice if you understand." He blinked. Once. Twice. Air moved back into the room. The nurse by the ventilator smiled with half her mouth and went back to numbers. Rowan placed 2 fingers at Marcus's wrist and felt a pulse that answered the monitor without bravado. She adjusted an IV-checked pupils, wrote a note that did not try to be poetry. When she stepped back, Mia stood in the doorway with a hand on the frame and a look that held both relief and something like pride. "You dragged him across a line," Mia said. "He walked," Rowan said. "I only pushed." Mia's mouth tilted. "If you say so." The hall took them in. It smelled like saline and a lemon cleaner that never quite hid the hospital under it. Pierce waited near the elevator's jacket, off tie, loosened eyes awake. He nodded toward the administrative wing. "Dr. Ward is free." Ward's office caught the last of the light off the sound. The city looked iron blue through the window blinds. Papers were stacked in clean piles. A framed photo sat on a shelf, a white ship on a gray sea. "You asked for the night," Ward said. "I will take your answer now." Rowan did not sit. "I will take the post," she said. Director of Trauma. Full privileges. Mia Sato as my first pick. No cameras where they do not belong. Honest review. Numbers, not slogans. "Agreed," Ward said. Her voice did not change. Her eyes warmed. "The paperwork is ready. It can be a formality, or we can take 10 minutes and read every line." "Sign it," Pierce said. He almost smiled. "You already do the job," Rowan signed. The pen left a clean stroke that did not wobble. Ward extended her hand. It felt like a handshake on a deck that did not pitch even when the water did. "Harbor light will be better for this," Ward said. "It is a hospital," Rowan said. "It will be what we make it at 3 a.m. The door closed behind them on a soft latch. The corridor was quiet in the way halls sometimes get when the floor below is busy, and this floor is catching its breath. Rowan went to the sink outside the staff lounge and turned the water hot. Pink lifted from a small scrape on her knuckle, thin to a blush, then to nothing. Clear. She watched the swirl and felt her shoulders drop. 2 weeks slid by, and then 3 months took their place. The fourth-floor conference room turned into a training space on Tuesdays. The simulation table wore a chest that bled fake blood and a groin that took a catheter for R.E. Bowe. Residents crowded the back wall and leaned in at the right moments. Attendings came and did not pretend they were only there to check on their people. "You are thinking 3 steps ahead," Rowan said, as she guided a junior's hand to the right spot for a tube. "Do the present step first, then let your hands tell your head what the next one is." The monitor beeped from the sim rig and then went steady. The junior grinned without showing teeth and taped the tube as if that were the most important part, which in a way it was. Mia ran the projector and fired clips from previous cases with identifiers scrubbed clean. The room went silent at the image of a heart paused inside a chest and a hand closing around it with care. The image passed, and the next slide showed a flowchart that had been written after a night when the chart would not have helped. Numbers lived on a whiteboard in the trauma office. Vitals for a program, survival up, time to knife down. Complications edged lower. The lines did not lie. They did not tell the whole story either. The staff told it with shoulders that did not tense quite so high when the radio crackled. The nurses told it with fewer raised voices and more quiet directives that cut through noise with a knife edge. One afternoon, a woman stood in Rowan's doorway and knocked on the frame with one knuckle. Early 20s haircut, short posture, straight as a pole. Her badge read, Jade Rivers, Clinician Trainee. "You are Dr. Keene," she said. "I am Jade, former Army medic. I was told to report to you." Rowan waved her in. "Sit. Tell me what you are good at." "Scene safety. Triage. Airway in a truck. Stopping bleeding. Making decisions when everyone is yelling." Jade paused. "I do not like long, quiet rooms. They make my hands doubt." Rowan nodded. "Long, quiet rooms can be honest. They tell you whether your hands know what they know without the drama. You will learn to like them, or at least tolerate them." Jade's mouth ticked. "What do you want me to do first?" "Shadow me. Then shadow Mia. Watch 3 chest tubes. Place the 4th. When you feel your hands go tight, say so. We will stop and let your head catch up." Jade looked at Rowan's hands. "Your knots look like mine," she said. "The kind they teach when the air tastes like dust." Rowan thought of a tent that flapped and a lantern that buzzed. She did not say the place. She said, "We are going to translate what you already know into a different dialect. That is all." The days made a rhythm. Morning rounds ran like small parades of carts and stethoscopes. The resident lounge smelled of coffee that had given up and pastries that did not. The ER spat out quiet hours and then a spike that set every alarm to the same pitch. The trauma board became a study in triage art. Red and yellow and green boxes moved under names and ages, under abbreviations that stood for what was hurt and how badly. A text arrived from a number Rowan had stored and labeled with a simple M. A photo of a young man with a soft beard and a mariner's cap sitting on a couch, smiling with a tube nowhere in sight. The caption said, "I start classes in September. Paramedic track. Thank you." Rowan saved the picture to a folder that already held a man standing at a shipyard with a hard hat on and both hands high and a plate of eggs in a kitchen where a toddler's high chair sat in the corner. Her phone screen went black. The small weight of the metal coin in her locker was still there when she checked between cases. She rolled it across her fingers once and put it back where it lived. On a Thursday, a board meeting ended with applause that could have been for the numbers or for the people who had made the numbers. Pierce handed Rowan a folder without a word. Inside were 2 requisitions stamped approved. One was for a second attending hire. The other was for a run of supplies that would let the training lab run at full speed for a season. "You get your way," Mia said at her shoulder. "We get our way," Rowan said. Jade appeared in the doorway with a chart. She wore new scrubs that still held their crease and a face that had sweat on it and a light behind the sweat. She said, "The trauma pager is hot." The overhead speaker confirmed it. A calm voice that never sounded excited delivered the facts. Pedestrians struck by a vehicle, multiple critical, 4 minutes. The ER began to turn while they were still listening. Carts rolled, packs opened. The big doors at the end of the hall apologized before they swung wide. Rowan stood and the coin in the locker went still. She pulled on gloves and felt the snap against her wrist. The skin there held a faint white line that only showed under certain lights. Mia fell in on her left. Jade took the right and matched stride. The floor shone under the lights. The air went thin with motion. They hit the corridor, and the rhythm found them. Beeps lined up along the wall panels. The triage board flushed red in new squares. The ambulance rig lights washed the glass in a pulse that matched their steps. Rowan reached for the curtain of Bay 1 and felt the familiar settle into her bones. "Let us go save a life," she said. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.